It's here again, the Health Ministry's Weekly Review. On Sunday last, President of Guyana, His Excellency Dr. Mohamed Irfan Ali, and Dr. Frank Anthony, Minister of Health, commissioned a state-of-the-art pathology lab costing $474.6 million to enhance diagnostic speed and accuracy at the Georgetown Public Hospital Corporation. Equipped with advanced tools like pathology scanners and tissue processors, the lab employs telepathology for digital image transfer, significantly reducing biopsy to diagnosis time from 3 months to less than 7 days to further slash it to 48 hours. During his brief remarks, Dr. Anthony explained the benefits of having a modern and digital pathology laboratory.
With this pathology lab, we realized that these tests that we need to do if we are going to advance how we treat cancer in Guyana, it's not just about doing the imaging, but we need to make sure that we can do the various types of testing.
On Monday, the Health Ministry's Mental Health Unit, in collaboration with PAHO WHO, launched a 3-day suicide crisis helpline workshop. The 3-day workshop will equip hotline operators with the essential skills and knowledge needed to man the hotline, while also aiding in the development of the standard operating procedure guidelines for the helpline. While applauding the helpline initiative, Dr. Anthony also highlighted that much progress has been made thus far with respect to the country's mental health and suicide prevention legislation.
With the help of PAHO and a number of the experts, we were able to pull that together, I think, in record time. And so we have a very comprehensive piece of legislation. And we took that to Parliament, we got it passed. And so we have updated what was before.
On Tuesday, a $49 million digital X-ray machine was commissioned at the Maikoni Cottage Hospital in Region 5. This marks a key milestone in the ministry's initiative to replace all analog X-ray machines with advanced digital devices for improved service delivery. During the ceremony, Minister Anthony had this to say.
With the type of equipment that we now have, you will take the image and it will be stored digitally, but if you need it to be enhanced, you can also enhance it with the equipment that you have. So that's one great advantage. The other advantage is that the exposure to patients to radiation is far less. And so you don't have that fear that you used to have before, that you have a lot of radiation. The radiation is far less exposure to the patient and to the person who is doing the image. The other great advantage of this is that we're able to then send these images, if it's needed, to Georgetown Public Hospital, where you can have a second opinion by a radiologist.
Meanwhile, on Wednesday, February 7th, Minister Anthony and a team of officials had executed a number of initiatives in Region 1. The Cocoa and Wallaba health posts were recommissioned to provide quality healthcare services to residents within those communities. During his brief remarks, Dr. Anthony stated that the ministry is working towards improving services across the region by upgrading all health facilities to better serve residents within those communities. Moreover, a site visit for the new regional hospital construction site was conducted at 3 Miles Morocco, located in Region 1. This site, upon completion, will be the home of a world-class health facility. In concluding his day of activities in Region 1, the Comaka District Hospital had commissioned a new maternal and child health sub-region office. The newly commissioned Maternal and Child Health Office aims to provide services for residents within its sub-region, which houses 18 facilities. Minister Anthony, during his remarks, stated that over the last 2 years, the region has seen no maternal deaths, which he highlighted as a great accomplishment for the health sector.
We started from a point where we had a lot of maternal deaths or complications. And we are at a point now where for the last 2 years, we did not have any maternal death here. And that's a big accomplishment. I think they deserve a big round of applause.
On Friday, February 9th, at the Ministry of Health headquarters, 300 sexual assault evidence collection kits valued at $3.7 million were handed over to the Ministry of Health and the Guyana Police Force. These kits will aid both organizations in combating sexual and gender-based violence in Guyana, especially in the remote communities. Also on Friday, the ministry's Chronic Disease Unit hosted a wellness and health fair in observance of World Cancer Day, which was commemorated on February 4th at its Brittan headquarters. This has brought us to the end of this episode of our Weekend Review. Until next time, stay well and do continue to protect yourself and loved ones from the Saharan dust that is affecting areas in Guyana. Let's not forget to also wear our mask and stay protected against the spread of the COVID-19 virus.